to learn more things and perhaps wake up certain things that they already know to take care of the body, which is a temple of the Holy Spirit. Thank you for your goodness. In your name we pray. Amen. Okay, so diabetes is a thing, not too sweet, because too much sweet things can go wrong. So what is diabetes, okay? So diabetes is basically a disorder. When the body can't really work, with the overload of sugar, it's a disorder that affects the way your body uses food for energy. Everything that you eat, when it comes to plants, when it comes to grains, when it comes to what we call carbohydrates, everything turns into what we call sugar or glucose. That is what the brain uses for energy. That's why when you see people that are in what we call high protein diets, pretty soon they feel lightheaded. Because people get so excited with those diets, when they go high protein diets, and they take away the sugars, which is the what? The energy for our brains. So if we take that out, pretty soon you feel lightheaded. Plus, it's not a very efficient way to lose weight because most of it is muscle and water loss. When you have a lot of protein in the body wants to get rid of a lot of what? Excess protein. So it uses urination as a way of doing it. So it puts a lot of pressure on the kidney. So not a good way to do it. Type 1 diabetes, 2 types. Okay, the type 1, that is about 5% of all the diabetics in the United States is the type 1. Okay? So that one is also called juvenile onset diabetes at a very young age. People that are kids, they might have it genetic wise. So that's what that is. It's very a small amount, and sometimes you can even tell of these people, but because they're very skinny. And there's people that are skinny, and they always say, but how come I have diabetes? Perhaps your genetic pool, part of it. Now, I'm going to talk a little bit about the genetic pool later on, because a lot of people think, oh, my mom is diabetic. My grandpa was diabetic, so I'm going to be diabetic too. Not necessarily at all. Type 2 diabetic. This one is one of the easiest thing to do for you to get rid of it, because it's mainly controlled with food and movement. And if you can do both, you're in the right track. Okay? Now, if you're diabetic right now, your doctor told you that you can't get rid of it and this and that, there's so many studies right now that have been done that just with the plant-based diet, good exercise, people can get rid of it, all the medication. I've seen it in my practice over and over. Within 2-3 weeks, people get rid of them like that. And I'm talking to people that have what? Type 2 diabetes. Okay, so you can do it, and it's very possible. Gestational diabetes, this is when people are pregnant. Some people have the placenta resistance. It doesn't really work that well, but that's something that is during pregnancy. It doesn't mean that at the end you're going to have diabetes. Some people think, oh, I'm going to keep diabetes. No. It's just that part of it, okay? So there are several ways you can get tested. Oh, something happened here. But anyway, the hemoglobin A1C, what they do, the doctors, what they do, they go about 3 months, and they take an average of it. That's one test that can do it to let you know where you're at, okay? The other one is called fasting plasma glucose. It's one way they can also do, you've got to fast about 14, 17 hours, and then the next day you go to the doctor, they draw blood, and then they check the numbers. It depends what the numbers are. They'll let you know if you're diabetic, pre-diabetic. That's one way to do it. And the last one, the oral glucose, is similar. You're fasting. They draw some blood out, and then they give you this very sweet, it's like orange stuff. It's about 75 grams, 50 to 75 grams of sugar, and boom, you take it right away. Some of you might like that because it's very sweet. I tried it before, but it's crazy. When I was going through school, we had to try that because it was part of the things we had to try, but it was very, very sweet. And then you let it go for an hour, 3 or 4 hours, and then depending on the numbers you get, that's how they determine whether you have diabetes. So there's different types of tests that the doctors will do for you. And the most important thing, don't guess. Go to the doctor if you think I'm going to give you some symptoms. Here you are. These are some symptoms type 1 diabetes people might have. Frequent urination. A lot of times you wake up and all of a sudden, wait a minute. I urinated like 20 times today. So if you see that over and over and as a pattern, everything that I'm telling you right now is not a diagnosis. It's just symptoms that you can feel. So if you feel frequent urination like you never had before, possibility. Unusually thirst. You feel thirsty, like all of a sudden you start getting thirsty. That's another way of doing it because the body becomes thirsty. Okay, extreme hunger. Some people get really hungry, and that is because part of the sugar is not getting into your bloodstream. I mean, in your cell. Unusual weight loss. Some people lose weight very quickly. Okay, extreme fatigue and irritability. Sometimes you talk to people, hey, how you doing, John? Hey, don't talk to me. Maybe you say, man, this guy might be diabetic. But that could be one of them, okay? Type 2, same symptoms as type 1. You know, it's very similar. And also they have frequent infections, okay? This group, they have that blurred vision. I'm going to talk a little bit about what happens with that. Cuts and bruises that take longer to heal. Sometimes that's healed, okay? Something happened there. Numbers, your hands become numb and your feet as well. Some people get all those are symptoms. Okay, let's talk a little bit about complications because this is very important. This is when you have to pay attention because some people just take things very easy. Cataracts, cloudy of the eyes. Sometimes your eyes become cloudy. People are reading, all of a sudden they can't read any longer. They go to the doctor and they just go over and over. Who knows? That could be a possibility that there's a symptom for diabetic. Okay, retinopathy, damage to the eyes and the retina. That is crazy. Many people right now is one of the leading causes of blindness, diabetes. Did you know that? In the United States, it's one of the reasons many of the blindness are causing right now is diabetes. Glaucoma, damage to the optic nerve. It tells us that is the nerve that tells us the brain, you know, what's going on. So those are things that you can have complication-wise. So be careful. Oh, here are some of the slides here. Some people they think they're crazy, but they're not too bad. Anyway, the foot and the skin. This is crazy. When I was doing my internship, part of my rotation, I did it here at Providence Hospital. And this is my first patient I ever had in the hospital. So I'm very excited. And boom, I jump up. And then you always with the doctor. And the doctor said, Oscar, these are your people. You know, he gives you the rounds and he tells you, these are the people that you're going to be taken care of. And when I was going up there, I saw it was a priest all the way from Spain. He came down here because they said the United States was excellent to cure diabetes. So they brought him all the way from Spain. That's a long flight. Came down here, and he didn't speak a word of English. So I was excited not only because it was going to be my first patient, but I wanted to make an impact on somebody. So I rush up there, and then I meet him. He says, wow, you speak Spanish. ¿Sabes español, verdad? And he was really happy, saying that I speak Spanish. I said, yes. So excited. And what happened is the next day, I'm very excited again. You know when you get a job? Do you ever get excited when you get a job? Some of you like, oh, I don't really get excited, but I'm crazy. I love my career. So I'm up there, I'm running, so excited, and then what do I see? I see like 4 doctors coming towards me, and all of a sudden I see that they get in the room of the priest, and I said, are these doctors on crack or what? How come are they going in that room? They shouldn't be there. Well, the doctor said, Oscar, he just went like this. That means to go around to the other patients. So I went, and when I came back, as soon as I opened the door, the priest started like bawling. Oh, Oscar, I want you to tell. He's 38 years old. What happened? They're amputating his leg all the way up here. 38 years old. I mean, come on, that is like in prime time. And he started crying and telling me, let this be like an experience for you to see. Tell the people out there when you go, I neglected that for so many years. I knew it was diabetic. I didn't do anything about it. And this is what's happening to me, consequences. So brothers and sisters, I'm sharing that from my own experience, what I saw, and a lot of things that I always see. Okay? Diabetes can take your limbs away, and also it can kill you. I've seen clients of mine die because of that, okay? Because they don't pay attention. So what happens? The skin, that doesn't look too good, huh? That hole right there, he didn't get burned. It's not a burn. It's actually, what happens is, as we having a lot of sugar in the blood, our blood vessels just start breaking. Just pretend it's like a bridge. You know, when like Ballard Bridge, by the way, the guy that works in Ballard, that's my brother, so be nice to him, all right? Whenever he stops you, I don't want you to say, hey, get that thing down. And you say, that's Oscar's brother. But just want to say, you know, when you got the traffic that is going this direction, all of a sudden somebody picks the bridge up, that there's no way you can get across. Well, this is the same thing that happens. Part of the, one of the functions of all the blood vessels is to, they work like a little bridge. That's where all the nutrients run for our bodies, all right? So when something breaks because of the sugar content, because they form crystals in there, they break the blood vessels, what happens? Then the nutrients don't get across. So if I get a cut in my toe, like here, for example, down here, I get a cut, and then there's breakage right here of the nerves, of the blood vessels, then my nutrients are not going to get here. So these little guys, this foot, it's never going to heal. So what happens? It dies. And when it dies, you don't want to die, so they cut you up. That's what they do. So that's why they took the skin off, because it turns black. I've seen it many times. It looks ugly. Okay? So that's what you see people that start losing their limbs. I've seen people, their arms, fingers. When you get hit, or you get, especially people that wear tennis shoes, every single time they wear tennis shoes, they have to look at their shoes, because sometimes there's like a little, you can have nails or something, and if you get poked, it's crazy, right? So that is really something. Now let's look at this. These guys right here, these are phenomenal. I mean, if you know the physiology, how this thing works, I mean, I just love everything that they do. They're very small, and by the way, we as humans, we can function with one kidney. That's how precious the Lord made you. If you have one kidney that is bad, He gives you another chance. You can actually function that way. But we don't want to ruin it like that. These guys, they have what they call nephrons, and what they do, they help you filter stuff. Every time you and I eat, we eat crazy food, we eat good food, things filter waste. That's what the kidneys do. They get rid of things, okay? So, but when we start losing this, and this one helps you get rid of liquids, that's why people that start losing their kidneys, pretty soon they start going to what we call dialysis. You ever heard of that? And that is crazy. When I was in the stage of dialysis, I saw a 20-year-old. People that are in there, they usually are in for about 4 hours. And they're watching their blood. Some people are falling asleep, but it's a crazy thing. They have to get rid of it because your kidneys are not flushing things out. And if you don't flush things out, you'll get poisoned. And if you get poisoned, that's it. So it's very crazy, okay? I know some of you are saying, man, Oscar, you are crazy. Yeah, that's enough. But it's reality. I'm waking you up. If you didn't know that, well, that's what happens. Plus, that thing is so expensive. Dialysis is so expensive to do it. If you don't have insurance, my goodness, it's extremely expensive. So you don't want to go that route. And to top it off, it's very hard for people to get into diets because you have to be careful for sure, protein content. You can't really eat too much things with protein, a lot of crazy stuff. Okay, so they start eliminating things from your diet, so you don't want to go that route. Okay, but prevention looks a lot better, don't you think? Yeah. I mean, look how good this thing looks. Okay, good bread, all the good stuff. So, vegan diet. Right now, there's a doctor that I've been studying quite a bit, and there's many doctors lately that have been doing some great work. One of them is called Dr. Neil Bernard. I don't know if you ever heard about him, but he's done some great work with diabetes. What he did first, he went and took some people and put them on a vegan diet. These were diabetics, okay, completely vegan. There's different types of vegans, vegetarians. Vegan, it means no animal product whatsoever, just plant derivative. That's it. Animal, it's out of the question. That's what that means. And when he did the study, and he did 3 variables only. He went on a vegan diet, lower the fat and the sugar. That's it. He didn't even play around with the exercise part. He left that alone. Okay? So he basically the people that he started working with, that's all. These are the 3 variables that he worked with. And what he found out, people that went on that, some of them eliminated the diabetes, and other people were much better than if they were taking medication. Just on that alone. Now, these right here, to me, is very cheap. Cheaper than medication. Do you agree, yes or no?
Yes.
I mean, that's very easy. That's what I'm saying. Anyone that has type 2 diabetes is a done deal for you. It's in your hands. All you got to do is just do it. Now, if you add exercise, oh boy, that is even better, because exercise serves as insulin. Same thing. It works because we have sugar. Remember, the body stores sugar, liver, muscle. Okay? So as we start moving the sugar, then as the muscles move, guess what? We're using what? Sugars or energy, which is, it's called glycogen. That's the name of it, that is stored in the muscle. And we use it as energy. So that's what we need. And when you exercise, it feels great. Okay? 2 types of exercises we already done. Remember, we done, here we do, everything that we do here is called what? I told you at the beginning. Who knows? Who remembers? IT stands for what? You don't remember? Interval. Very good. That's the type of training we're doing right here. Because to me, that is one of the best ways, not only to lose weight, or to lose weight, that is the key.